Hi all, welcome back to a new session. Today we are discussing about the topic fetus in utero. The fetus lies inside the uterus in a closed sac filled with liquor amni or amniotic fluid. It has enough freedom of movement until the later months of pregnancy when it becomes relatively fixed. So by the later months of pregnancy, the movement of the fetus is fixed, and before that the fetus is freely mobile within the amniotic fluid. So now we are going to discuss some of the terminologies related to the fetus and lying in the uterus. First one is lie. The lie refers to the relationship of the long axis of the fetus to the long axis of the centralized uterus or maternal spine. So it refers to relationship of the long axis of the fetus to the long axis of the centralized uterus or maternal spine. The most common lie is longitudinal, that is 99.5% of the fetus lie in longitudinal position, and lie may be transverse or oblique. So it can be transverse. So it's transverse means in the horizontal plane, and oblique means a plane between the vertical and horizontal plane, that is oblique. So lie once again lie refers to the relationship of the long axis of the fetus to the long axis of the centralized uterus or maternal spine. Next is the term presentation. So what is presentation? The part of the fetus which occupies the lower pole of the uterus, that is the pelvic brim, is called presentation of the fetus. So the part of the fetus which occupies the lower pole of the uterus or the pelvic brim is called presentation of the fetus. And 96.5% are cephalic presentation, and only 3% is podalic or breech presentation, and shoulder and other presentation is 0.5%. Sometimes there will be more than one fetal parts present, and it is called compound presentation. So when more than one fetal part is presented, that is called compound presentation. Next is the presenting part. What is the presenting part? The presenting part is defined as the part of the presentation which overlies the internal os. So the part of the presentation or the presentation which overlies the internal os and is felt by examining finger through the cervical opening. So when we are doing pervaginal examination, the part which is felt is called the presenting part. So the part which overlies the internal os is called the presenting part. So for the cephalic presentation, the presenting part may be vertex. The most common one is vertex, and it can be brow or face also, depending upon the degree of flexion of the head of the fetus. Then sometimes fetal legs may be presented, and the fetal legs may be flexed in complete breech presentation, and it will be extended in frank breech, and a footling presentation, that foot will be presented sometimes. It is called footling presentation. So there can be complete breech, that is flexed breech, and frank breech or extended breech, and also footling presentation when the foot is presented. So that is regarding the presenting part. The part which overlies the internal os is called the presenting part. So this is regarding the lie. You can watch the diagram given. When the uterus is in line with the maternal spine and the vertical axis of the uterus and the fetus is common, so that is called longitudinal lie. In the other picture you can see the uterus is little everted from the longitudinal spine line, and the same axis of the uterus lies the fetus in B. So both are longitudinal because the axis of the uterus as well as the axis of the fetus are same. So it can be called as a longitudinal presentation. So longitudinal lie. Then when the oblique lie, you can see it is a plane in between the vertical as well as horizontal. So it is not in the axis of the uterus. It is another axis between the horizontal and vertical plane. And in transverse lie, you can see that it is exactly 90 degree to the vertical plane. So it is in the purely in the horizontal plane the fetal axis lies. So that is the relationship between the vertical axis of the uterus and vertical axis of the fetus, that is lie. So next is regarding the presentation, various type of presentation. We can see the vertex presentation, in which the vertex is well flexed. So in that case, the presenting diameter is 9.5 centimeter, and in deflexed head, the vertex presentation has 11.5 centimeter, and in brow presentation, you can see the diameter is 14 centimeter, and also in face presentation it is 9.5 centimeter again. So these are the various type of presenting parts in vertex presentation. Next is regarding denominator. So what is denominator? It is an arbitrary bony point, or arbitrary bony fixed point on the presenting part, which comes in relation with the various quadrants of maternal pelvis. So it is an arbitrary bony fixed point on the presenting part, which comes in relation with the various quadrants of the maternal pelvis. So it can be as the following. You can see occiput in case of vertex presentation, and mentum in case of face, and frontal eminence in case of brow, and sacrum in case of breech, and acromion in case of shoulder presentations. So once again, it is an arbitrary bony fixed point on the presenting part, which comes in relation with the various quadrants of maternal pelvis. So the denominators can be occiput in case of vertex, mentum in case of face, frontal eminence in case of brow, sacrum in case of breech, and acromion in case of shoulder. And next is position. So what is position? It is the relation of the denominator to the different quadrants of the pelvis. So it is the relation of the denominator to the different quadrants of the pelvis. So we have different quadrants of 45 degree in a maternal pelvis. If it is taken as a circular plane, so there will be 45 degree into 8 positions. So 8 into 45 degree sections are there, and in each area there will be some position. So theoretically there are 8 positions with each presenting part, and anterior, posterior, right or left position is referred in relation to maternal pelvis. The vertex occupying the left anterior quadrant of the pelvis is the most common one, or LOA, left occipito anterior position, is the most common position of the fetus. So you can see this is the position. So we can see it has divided into different quadrants of 45 degree. The anterior position occipito anterior, left occipito anterior, and right occipito anterior, and transverse position right occipito transverse, occipito transverse. And in the posterior there are another 3 positions, that is right occipito posterior, left occipito posterior, and occipito posterior. When you can see the percentage, the left occipito transverse is 40%, and left occipito anterior is 13%, and right occipito transverse is 24%. The conditions where the height of the uterus is more than the period of amenorrhea. So which are the conditions of where the uterus size is more than the period of amenorrhea? First one is mistaken date of last menstrual period. When the woman does not have a clear idea about the LMP, then there can be a change. Then twins. In case of twins, the uterine size is more than the period of gestation. Then polyhydramnios, that is excess of amniotic fluid. Then in case of big babies, especially in diabetic mothers and all. Then pelvic tumors in case of ovarian or fibroid like tumors. Then hydatidiform mole. It is not a normal pregnancy, so it is hydatidiform mole. So that case also we cannot predict the size. And in case of concealed or accidental hemorrhage which underlies the placenta. So these are the conditions where the height of the uterus is more than the period of amenorrhea. Next, where the condition of the height of uterus is less than the period of amenorrhea. Conditions where the height of the uterus is less than the period of amenorrhea. First one is mistaken date. Already we have told in the other class also, mistaken date. The human may not have a clear-cut idea about. Then second one is scanty liquoramni. So in case of oligohydramnios. And third one is fetal growth retardation or intrauterine growth restriction or retardation. Then intrauterine death. So all these cases, the height of the uterus will be less than the period of amenorrhea. And an important point regarding the palpation is during Braxton his contraction or uterine contraction in labor, palpation should be suspended. We should not palpate the uterus during Braxton Hicks contraction and also in case of uterine contraction during labor. So we should not palpate. So this is the different manuals of uterine palpation. These are called obstetric grips or Leopold manuals. So first one is fundal grip. So first Leopold manual is the first one for fundal grip. Second one is lateral grip or second Leopold manual. And third one is pollic grip or third Leopold manual. And last one is pelvic grip or fourth Leopold manual. Regarding some points regarding auscultation, the auscultation of distinct fetal heart sounds, that is FHS, only helps in diagnosis of a live baby, but its location of maximum intensity can resolve about the presentation of the fetus. So when we are hearing the FHS, it is sure that there is a live baby, and with the position we can identify where the baby lies or in which position the baby lies. The fetal heart sounds are best audible through the back or the left scapular region in case of vertex and breech presentation. And in face presentation, the heart sounds are heard through the fetal chest. And maximum intensity of FHS is below the umbilicus in cephalic presentation and around the umbilicus in breech presentation. That's all regarding the fetus in utero. Some points for the multiple choice questions. So study well, stay focused and get a respectable rank in the coming exams. Thank you. If you have not subscribed this channel yet, kindly subscribe this channel by clicking the subscribe button below.